She's the chair of the House Majority Leader's Task Force on Poverty and Opportunity. Congresswoman, thank you for being here. Congratulations on the bill and the things that you did. And I want to continue the conversation that I had with Sheila, because you had a singular focus in the things that you worked on in this bill. And it was not just short-term relief, but it was actually poverty alleviation. They are two things. They are both important, but they're a little bit different.
Yes, and thank you very much for having me, Ari. And poverty relief, first of all, we need to eliminate poverty in this country. There is no reason why we see so many people needing food. They're hungry. And so we did extend the 15% increase in SNAP benefits, but also with the child tax credit. This is extremely important because, as the prior one on your show just mentioned, this will actually begin to lift children out of poverty. But also we had to, in this bill, put in money for direct cash assistance, for enhanced unemployment benefits, because people's benefits in terms of unemployment was going to run out on March the 14th. So we had to do that. We continue and will continue to fight to increase the minimum wage to $15 an hour. People right now at $7.25 an hour, they're working for poverty wages, yet they're still working, and they need SNAP benefits. They need the child tax credit. They need public housing. They need assistance just to survive, and they're working. So we must increase the minimum wage.
Let me talk about that, because at $7.25 an hour, the annual wage is about $15,000. You cannot keep a family alive. You can't keep an individual person alive on that. At $15, it's $31,000 a year. Where are we on this? Because there was an attempt, obviously, to put it into this bill. It didn't work. What happens next on the minimum wage discussion?
Well, Ari, I don't know if you remember, but we started in 2014, 2015 as a progressive caucus, going around the country supporting legislation. We called it the Fight for 15 with our labor union brothers and sisters. And so we've been working on legislation for years to increase the minimum wage to $15, which of course is a floor. We have to move to a living wage. And so we're going to once again keep moving with the legislation. We're going to get it through the House, and then we'll work, and I've talked with Senator Sanders and others, and we're going to figure out ways in the Senate to get this passed. People should not have to work and live below the poverty line. So where there's a will, there is a way, and we're going right back to the drawing board as we speak to try to figure out how we're going to get this $15 minimum wage increase legislation passed.
Congresswoman, a couple of weeks ago, I was in Birmingham, Alabama, talking to black residents there, and a number of them said, you know, we need a fairly aggressive campaign to understand the safety of this thing. There are little conversations that go on here and there about the vaccine. One of the things you did is you helped get $1 billion into the bill for vaccine confidence activities through the CDC. What does that do? Where should that money go?
Sure, and thank you. And, you know, we worked to get billions of dollars in for strategies addressed to black and brown communities, medically underserved communities, those communities that have been disproportionately impacted by this deadly virus. And so this is, it's about access primarily. And so what we have to do is make sure that people of color have access to the vaccine. And also the research has proven that once family members have access and get the vaccine, or community members, then the likelihood of those trusted messengers delivering those messages to others works. And so we have to have vaccine, confidence building, but we also have to make sure that there's access. So many people I know in my communities, especially senior citizens, are not able to go online to set up appointments, and so we have to have access so that the people who are working to deliver the vaccines can come to their homes to provide the shots. But also we have to have, and we put into the bill, billions of dollars for workforce training so that community-based organizations and faith-based organizations can recruit, train, and hire individuals to deliver these public health messages so that we can make sure that the access and that the confidence building is there through trusted messages who would be culturally and linguistically appropriate for those targeted communities.
Congresswoman, thank you as always for taking time so early in the morning to be with us. Representative Barbara Lee is a Democratic Congresswoman from California, closely involved with a number of the measures in this bill. Thanks for being with us.